Hello, my name is Dr. Michael Codsi, and I'm an orthopedic surgeon at the Everett Clinic here in Everett, Washington. And I want to take a moment to talk to you about one of the more common causes of shoulder pain, namely impingement syndrome. Impingement syndrome is a problem that can cause pain in patients mostly on the side of the arm, right here. Most people come in and say it hurts right on the side, or sometimes right here in the front of the shoulder. And just for orientation here, this is your collarbone here. Here's your big deltoid muscle here with your arm right there. And curiously enough, some people even say the pain can radiate all the way down to this portion right here. And some people might say the pain is only right here. It doesn't really happen in the shoulder. But actually, pain that is right here in the shoulder is 99% of the time coming from the shoulder joint itself. And it is often made worse when you reach your arm straight out to the side here, or when you raise it up maybe to about 120 degrees here. Sometimes it can actually get better when you put it straight up in the air, or you put your hand behind your head. But that's not common. Now, some of the causes of this type of pain here that make up impingement syndrome. The first one, and the most common one that most people know about, is a bone spur. A bone spur can form right underneath this bone right here, which is your acromion, which is part of the shoulder blade. And these bone spurs occur with aging, and sometimes can get worse with injuries. And this bone spur can rub up against this bursa right here and cause it to be inflamed. And when this bursa gets inflamed here, which is this blue structure right here, it can get filled with some fluid, and it can become painful, and again cause pain right here on the side and radiate all the way down this muscle right here. And sometimes that irritation can go over to the rotator cuff here, and that can become inflamed. So first thing is a bone spur can cause impingement syndrome, and when you raise that arm up to the side right over here, this bursa becomes close to this bone spur, and it can make the pain even worse. So if you have bursitis, which can be made worse with that bone spur, and then finally that rotator cuff tendon, if that's inflamed, you can have tendinitis. And when you have all three things going on here, your pain can be pretty significant. Most people complain of pain that occurs with activity, but it can get really bad, and it can be a constant pain, almost like a toothache that just doesn't go away, and is made worse when you reach out to the side, or even when you reach to put your arm in your shirt or in a jacket. And a lot of people complain of pain when they sleep at night. You know, when you lay flat and you don't have anything to distract you, your shoulder can really cause significant pain. So the way you make this diagnosis is when you come to your doctor or your medical provider, and they listen to the type of pain you have, and they find out that your pain is right here or on the front of your shoulder. Then they'll also do a physical exam, because there are certain maneuvers that can help you diagnose impingement syndrome. And then your provider will decide whether to get any x-rays or even an MRI if you don't respond to treatment appropriately. So let's talk about the treatment of impingement syndrome here. Let's take out our notes here, and some of the treatment options. The first treatment option for this is therapy. And therapy is meant to help rest the tendons that are painful. So if this tendon right up here on the top, which is the most commonly affected underneath that bursa, is really inflamed, what we want to do is rest that tendon and let the other tendons, say the one in the front here, the one in the back of the shoulder, and all the other muscles that are around the shoulder here, help take up the slack for this one here, which is getting too much stress. And your therapist would teach you these exercises to help do that. Another thing that therapy does is it helps you improve your posture. because if this shoulder blade is actually tilted down, or you slouch your shoulders, then when you raise your arm, it puts increased stress on this tendon right here. And any increased stress can aggravate the pain. So if you hold your shoulder blades back and you make them stronger by giving a little more support to the tendons around your shoulder, you're going to get less pain and allow this to heal. Sometimes when therapy isn't responding well, or your shoulder isn't responding well to therapy, sometimes you want to consider a shoulder injection. And an injection is a steroid that's injected into this bursa here, and that helps decrease the inflammation in that bursa. And an injection is really like a Band-Aid. It's meant to temporarily relieve the pain in the bursa and this tendon here, so that therapy can do its job and help let your body heal the pain that's going on in the shoulder here. Don't think of an injection as just a temporary fix. It really is an adjunct or an addition to the other treatment options here. And getting 1 or 2 injections will rarely cause permanent damage to your shoulder. If you get multiple injections every month, say, that can cause damage. But 1 or 2, probably not. And I'd say with this treatment here, about 80 to 90% of patients get good pain relief. Say 90 here. Get good pain relief. The only problem is it does take about 3 to 6 months to get rid of the pain. Now, if you've been doing therapy, you've been doing it for, let's say, 6 or even 8 months, you said, I'm going to give this a good try here, and nothing seems to be working, then the last option you have to help treat this is surgery. And surgery is usually done arthroscopically. It's an outpatient procedure, and the goal of surgery here is to go in there and get rid of the bone spur that you might have in there, and it will also usually excise this portion of the bursa here, because your body will recreate that bursa and it will be less painful when it does it, and remove any irritated tissue that's in there to give this shoulder and the tendons underneath the best chance to heal. Surgery works about 70% of the time, and most people, their pain goes from an 8 out of 10 before surgery to about a 2 out of 10. And the recovery time is about 6 months. So it's not a quick fix, which is why I usually recommend people start with therapy and injections. And it's not without risks. There are risks involved with surgery, and when you talk to your surgeon about this, they can provide you with the details about what those are. And again, this is something that should be treated by your healthcare provider, should be diagnosed by your healthcare provider, and they can help monitor your progress with your treatment.